Okay, Sue, I have one question before you start.
Sure.
Are you just going to read the chat stuff, or where do I find it?
There is a chat window down at the bottom.
Okay.
If you hold your mouse.
Oh, maybe because I have the screen up a different way. That's okay. If you just don't mind telling me if there's something there, just stop me. Was that okay?
Sure.
Okay, thank you. Okay, you ready?
Okay. Well, our presenter today is Colleen Halupa. She's an associate professor in the Doctorate of Health Education program. Kathy, I can't see that window. Colleen has an EDD in curriculum and instruction and education leadership, and her research interests are online education, academic integrity, and the use of technology in education. Her presentation today is Benefits and Risks, the Impact of Online Learning and Technology on Mental, Emotional, and Social Health. Technology has pervaded almost every aspect of our lives, including education. Although technology can improve the educational experience, it can also detract from it if not used properly or in excess. This webinar will explore the effects of technology on mental, emotional, and social health. In addition, technology addiction will be discussed. So with that, Colleen, it's all yours.
All right, thank you very much. As she said, we're going to talk about technology today, and technology has pervaded all of our lives. It's mostly in everything that we do. Most people have cell phones. We're going to talk about how young people are when they first start getting into technology and how active they are. So there's just a few objectives for this session. The objectives are to identify how technology and online learning has proliferated K through 12 and higher ed systems. We're going to look at the positive and negative effects of technology. We'll analyze how technology has caused disparities that can impact emotional and mental health, and analyze how technology and online learning have caused disparities and risks that can impact social health as well. Basically, what it boils down to is everything is good in moderation, and when it becomes more than moderation and it becomes too important part of our lives that other things suffer is when it becomes a problem. All right, today, these are just some facts and figures, and we're going to start with children and we're going to go up to adults. 56% of children 8 to 12 years old have cell phones. All but 4% have data phones. If they have data phones, that means that they can easily access the internet. Maybe I was old-fashioned, but my daughter didn't get a cell phone until she was 16 when she drove. That was about 10 years ago. I got my son one when he was 14. He made a mistake with his data, and so now he has a non-data phone, and he's almost 18 at this point. So it depends. Well, a lot of times parents will give children technology for safety. 72% of children 8 and under have used a mobile device for a media activity. A lot of times this media activity will be watching a video or playing a game. My granddaughter has been playing with an iPad since she was about 6 months old. But again, not all the time and only in moderation. 38% of children under 2 have used a mobile device. And on the average, children spend 7.5 hours per day using technology. And that technology includes the computer for entertainment, cell phones, TV, any gaming systems, anything like that. As of March 2013, let's go on to teens. 78% of American teens have a cell phone. 98% of adults ages 18 to 29 have a cell phone as well. 47% of American teens have a smartphone. 32% own an e-reader. If you have a smartphone, you can have a Kindle app and you can have an e-reader on that if you like. 23% own a tablet computer, which would include an iPad or other devices. 74% use their phones to surf online, and 93% of teens have a computer or easy access to one. And these were the latest statistics that I could find. This is just a graph of teens in the internet, and if you look at this, you'll see that 95% of American teens were online by September of 2012, and that has increased quite a bit. And if you look at the difference in the different populations, even if you look at the people aged 50 to 64, they're up to 77%. And those 65 plus are up to 52%. So the internet has pervaded all ages, although it is more prevalent in younger groups. As of March 2013, 94% of teens were on Facebook, or now you have Instagram or Snapchat, but this particular data is on Facebook. 91% had posted a personal photo. Some of these personal photos were potentially provocative, and it has caused problems with those types of things being shared. We see it in the news all the time. 92% posted their real name. Some teens will not post their real name. I'm friends with somebody who posts her name as Trisha Marie. That's not really her name. That's her first name and her middle name. She does that to protect her identity. 75% of all teens text at least 60 times a day. So they are either reading or texting 60 times per day. And many teens sleep with their phones. In fact, 2/3 of adults sleep with their phones right in the bedroom or right next to their head. And this can be very disturbing to sleep patterns. Let's talk about online learning. In 2009 and 2010, there was almost 2 million secondary students enrolled in online high school courses. An additional 275,000 attended school full-time in 2011-2012. So a lot of students now are going to high school online. My son attended an online high school for several years where the teacher just was basically a facilitator, and they did all their courses online and they tested and they went on to the next. It was self-paced. 31 states have statewide full-time online schools. And although many of these classes are taken in high school, students as young as first grade are now taking courses online. There are technology disparities, however, which means that some people don't have the capacity for use of technology that others have. In 2013, low-income families, their capacity increased from 2011, where they were 27%, up to 51%. Access to high-speed internet increased from 4% to 42% in low-income families. Excuse me, it increased 4% from 42 to 46%. Tablet ownership increased to 20%. Only about 22% of lower income children had ever used a mobile device. By 2013, 65% had done so. And in 2013, 35% of lower income parents had downloaded apps for their children. If you look at this comparatively, 86% of higher income families have high-speed internet, compared to 46% in lower income families. In higher income families, 63% had tablets, only 20% in lower income families, and 75% of higher income parents had downloaded apps for their children, compared to 35% of lower income parents. So there is a digital divide based on income. The next thing we're going to talk about is impact on physical health. What kind of impact does technology have on our physical health? The first effect is a cognitive effect, and cognitive is our brain and neural functioning. Piaget noted adaptation to environment's a biological function. This includes assimilation and accommodation, which directly involve the nervous system of a child. Piaget felt that the development of individual children should not be individually rushed. Yet this is what technology does in so many cases. So much has been yet to be determined, particularly about students who begin technology interaction in infancy. How does it affect their brains? Because younger brains are more malleable than adult brains. In 1989, Heisen et al. Studied 4-year-olds, and they taught a control group and an experimental group, both academic and non-academic concepts. The academic group overwhelmingly had less creativity, which is an important part of problem solving later on in life, yet there was no differences in intelligence. So what this says is in fact technology going to impact creativity? Will children not be as creative as they were before because the technology kind of does it for them? And those are questions that researchers are looking at answering. This example of the creativity in the 4-year-olds is an example of brain development that may be detrimental in some way. When stimulus is presented either at the wrong time to a developing brain or in the wrong manner, the neural connections will accommodate in the non-preferred way. This is thought to be one of the causes of attention deficit disorder. Media and technology can also do this to a certain extent. Primarily, studies have been done on excessive television usage, which have been found to negatively affect health and academic performance. However, students engaged with technology don't engage in physical play as their ancestors did, so we're seeing impact on multiple fronts. Some researchers feel this lack of interaction in the physical environment can be negative and actually have negative effect on the brain. The reason is if you go back even to caveman times, our brains have adapted to our physical environment. When you take that physical environment out of the picture and you put it into a virtual one, there is the possibility that some effect may occur that's not quite what we had hoped. Some more information about cognitive effects. The negative effects on enterprise skills in preschoolers. Lilliard found that just 9 minutes of viewing something fast-paced, such as a video game, caused negative effects on executive function tasks. This is such as a delay of gratification and, for example, executive function skills are those skills that we need to cope in everyday life. It's knowing that there's repercussions for what our actions are. That we can't get everything we want exactly when and how we want it. And technology can take some of those thoughts away because anything seems possible. Also, excessive multitasking can impact attention. Technology is being used by some parents to entertain toddlers, and then this leads to a potential addiction, which I'll talk about a little bit later on in life. And Bavelier noted that technology can cause long-term changes in behavior and brain function, but this can be either positive or negative depending on what the stimulator is and how the exposure occurs. Let's talk about physical health negative effects of technology, and a lot of these are pretty much common sense. Colley in 2010 at the American College of Pediatricians also found that obesity is doubled and that technology is a contributing factor. Obesity can lead to diabetes, early onset heart disease. Also, lack of activity can cause decreased motor development. Also, if children are not physical, they lack interaction within their environment. This causes decreased sensory stimulation, and it can contribute to child's not reaching development milestones, and them actually to have the executive skills that they should have at their grade or age level. Other negative effects of technology, sleep disorders. We talked about it a little bit earlier. Children often sleep with their cell phone, but on another aspect, sleep deprivation can exacerbate obesity. Technology causes brain arousal, which is what prevents people who are either looking at technology perhaps right before bed or having it next to their bedside prevents them from sleeping. With the presence of technology in the bedroom, being overweight increases by 31%. Because if there's technology in the bedroom, media uses has been found to increase by 1 to 2 hours. Other problems include disordered eating, For example, if you have a child that's very absorbed in a TV show or a game show, they may not want to engage in regular meals and they tend to snack on unhealthy foods. Other negative effects that are physical are tendinitis in the thumb. This comes from gaming. Back or neck problems from poor posture when gaming or dealing with technology. Technology overload has also been found to cause generalized health complaints. People just don't feel very well because they're engaged in technology and they're tightened up all of the time. And then, of course, there's texting when driving a car, which can be very dangerous. Additional negative physical effects. There's an increased risk of smoking due to media exposure. There is a lot of media exposure on the internet. It's not all controlled. And so young children may be exposed to that and think smoking is cool. Decades ago, they got rid of smoking commercials on TV, but it still exists on the internet. Drug and alcohol abuse can be related to technology as well. Usually if this occurs, the drug and alcohol abuse as well as the technology abuse tends to be done because somebody's hiding from problems that they cannot deal with. And also media has been found to have a relationship with early sexual activity. Sexting and posting provocative photos on the internet to attract members of the other sex or same sex, depending on if they're what their gender initiation is.
Colleen?
Yes.
I have a question. Somebody asked, what exactly are included in executive skills?
Executive skills are a bunch of different skills that we get. For example, you can go from as simple as when we're very young, if we touch something hot, we get burned and we know that we shouldn't touch something hot again. That's a low-level executive skill. A high-level executive skill that we get around the time that we are in our teens perhaps, or maybe a little earlier, is to avoid danger. To know that if we do something that we're going to have to pay for that. For example, if I shoot somebody with a gun, I'm going to go to jail. Your executive skills start out very small as you're younger, and it's part of the growth factor where you actually learn to be a productive member of society that actually follows societal rules. Does that help?
Yes.
Okay. Now we're going to talk about the positive effects of technology on social and emotional health. Computer and internet access in the home can enhance academic achievement and happiness. If a student has a home computer, they actually have the capacity to actually do their work at home and not have to go somewhere else to do it, which is a positive thing. And exposure to educational media at a young age can have positive effects. Now, this is science-based versus quasi-educational. These are, when I'm talking about educational media, I'm talking about true educational media that's been developed as such. But in order for educational media to be effective, they have to elicit direct participation, and it should not be passive. Also, technology can increase our feeling of social connectiveness. And this can positively impact well-being and happiness. When we are interacting with technology with friends and not strangers. And that's one thing that I just wanted to bring up. You will find that a lot of teens or even adults may have 1,000 or more Facebook friends, but are those true friends that they feel a feeling of social connectiveness with? Probably not. A lot of times teens will accept friend requests just to have more friends than everybody else. Online learning can contribute to self-discipline and learning to reaching of goals, and it can make us more familiar with productivity software, which can make them more effective on the job. I teach undergraduate education as well, And what I have found with undergrads is when you actually make them use productivity software, they don't know as much as you think that they would have known. Our students are coming to us now very technologically savvy, but not necessarily into higher education, but not necessarily technologically savvy in things that actually are useful, such as productivity software. They're more savvy in things like social media, which I'm not saying social media is not useful, but social media and gaming. There are also negative effects of technology, and that includes technology stress. Technology stress, or using too much technology, can disconnect people from nature, from play, and from other people. We get so engrossed in our technology that we forget to interact with others. I don't know if you've ever seen, you know, the video of two people sitting on a couch and they're texting each other rather than talking. You know, that may seem like a joke, but it actually does happen with some people. Lack of social boundaries. Again, the posting of personal items, pictures, this has an interplay with sexual boundaries, and youth often will stretch these boundaries because they can do it on media, where they might not necessarily do it face-to-face. And then also a lack of face-to-face social skills. When people don't talk to each other anymore and they just text and use technology and email, they don't have the skills needed for social situations. And that impacts them when they go into higher education. It impacts them when they are on the job. Additional negative social and emotional effects. A decreased sense of time. I'm sure all of us have gone onto our computer or our tablets or our phones and have started surfing, and all of a sudden 2 or 3 hours have gone by. I know I've done it, and you lose that time. And when that time is lost, this can also lead to a decrease in personal happiness, a decrease in emotional, social health, and it actually increases the suicide rate. In addition, Park found that this particular effect can impact academic performance more than any other factor, because along with the decreased sense of time comes lack of future thinking, which is an executive skill. And with technology, people try to multitask with a negative effect on performance. You know, there's some people that say you can't really multitask, that when you multitask, everything suffers. I don't know if I believe that. I multitask, and sometimes I do it well and sometimes I don't. But if you look at the brain of the youth or teens or those coming to us of undergraduate college age, their brains are still not totally mature, and that multitasking may not work very well. Park also found that it increases impulsivity. So technology makes us more impulsive because we don't have that face-to-face interaction. You can say something that you would normally not say to somebody in person. And additional effects are isolation and loneliness. Relationships with real people suffer because people get too caught up in the virtual world. A depression, lack of self-esteem. Grusser et al. In 2014 found that excessive gaming causes both aggressive attitudes and behavior. Also, Bouvier found that technology changes arousal and mood. You can have a lack of privacy. There is no privacy anymore. Your whole world is out there because you put it out there on technology. And sometimes it's out there on technology whether you want it or not. Also, this leads to feelings of isolation, depression, self-esteem. Some people experience dissociative symptoms. They feel like they don't live in the real world anymore, and an altered sense of reality. When I'm talking these types of things, these negative effects, I'm of course talking of people that do it in great excess. But there are people out there that do it to great excess. I knew somebody whose boyfriend literally stayed in their bedroom 24 hours a day and probably gamed 18 of those hours and did nothing else. She supported him. Actually, I've known two people like that. Their wives or girlfriends have supported them, and that's all that they did because they had an addiction, and they weren't forced to do anything else because they were enabled by their significant other. So it does happen. The last thing I'm going to talk about really briefly is technology addiction. This is new, and there's been a lot of out there about technology addiction in the last year or so. This primarily became prevalent in Asia. Throughout the last year, several technology addiction treatment centers have been popping up throughout Asia, particularly in China and Korea. And when you talk about technology addiction, what this means is it means computer addiction, internet dependence, you can't live without the internet, compulsive internet use, pathological internet use, that means downloading pornography and things like that, problematic internet use. Problematic internet use is when the use of the internet affects negatively every other aspect of your life. Again, the fact that we're anonymous impacts behavior and causes people to do things that they might not have done otherwise. And technology has been found to activate the pleasure pathway in the brain. So using technology feels good. It's like a drug, and people want more and more of it. And to get that high, they have to interact with it more and more. This technology addiction is under consideration for inclusion in the DSM-5, which is the categorization for where psychological and mental illnesses and conditions are categorized. It's known as internet addiction disorder. The prevalence runs between 0.3 and 38%, and boys are much more likely to be addicted than girls are. China and Korea have ID'd it as a significant public health threat, and there also are centers popping up in the United States as well. And when some researchers did some comparisons, and what they have found is that internet use is like a gambling addiction in the way it's viewed and treated, because internet use gives rewards as gambling can, but it also can have negative aspects. In gambling, your negative aspect is when you lose. In technology addiction, your negative aspect is your real life more or less goes away for a virtual one that's not necessarily real. There are 4 components to technology addiction. With excessive internet use, you have a loss of sense of time and a neglect of basic drives. There's withdrawal, which includes feelings of anger, tension, and depression when the computer is not accessible. People will spend thousands of dollars on better equipment, software, and increase their hours of use. And negative repercussions include arguments with loved ones and family, lying about how often they're using technology, poor achievement in school or in the job or other aspects of life, and social isolation. There is a test for internet addiction, and it was developed by Young and has 8 constructs. The first one is preoccupation with the internet. The second one is people that need more time online. Third is repeated attempts to reduce use. Fourth is withdrawal when reducing use. Fifth is time management issues. Sixth is environmental distress. And this can be at home, school, work, or with friends. The 7th construct is deception around the time spent online. And the last is mood modification through internet use. There is also an additional internet motivation questionnaire out there as well. And that's basically all that I had. My references are here, although they're very, very small. Are there any other questions?
All right, we have one question. It says, has there been any research done that compares academic achievement and/or success in the workplace among people who are not digital natives, those born before 1980, and digital natives who were born in 1980 or later.
I have not seen any comparisons between the technology generation, the non-technology generation. In my search to put all this together originally, I didn't come across anything that actually did a comparison to those two groups. I'm not saying that there's not anything out there, but in my multiple searches looking for this, I didn't see anything. And when I did this originally, I targeted more toward what the effects are on the generations that are coming up that we're going to be seeing in higher education and graduate education in the future versus looking at adults. So.
Okay, we've got a couple more. What do you feel needs to be done with at-risk teens regarding the effects of technology?
This is a personal question, basically, for me. I have a son that I adopted from foster care when I was 9, and he has attention problems, and technology has already always exacerbated them. And what I found I had to do with him is I had to really limit him. And even if I limited it to a certain extent, if you have people that are at risk for technology addiction that just can't handle it, sometimes just taking it away is the best thing that you could do. He made an error, I said earlier, with his smartphone where he was playing a game and he charged up $2,000 worth of tokens on iTunes. And I was responsible for that. And I went to iTunes and I did get my money back, but you have to really, and he's not a bad kid. I don't want you to think he's a bad kid. He's not. He just cannot handle technology, which is why this is an interest area of mine.
Okay. As a follow-up to that, I'm going to skip over a question that was asked earlier and go to any suggestions for helping individuals overcome IAD.
I think probably the best thing that you can do is counseling. You know, I tried that route and it wasn't necessarily effective for my son, but I think now we're seeing more and more that since this is becoming more prevalent, we're going to see more counselors that are actually equipped to deal with this kind of thing. And they do treat it as they treat gambling addiction. So the same type of techniques are used. So like I said, I think that we're going to see more in the future on this. And there'll be more and better help out there.
Okay. How should we address or support behavior change of technology? Meaning, how do we dial it back if there tends to be deficiencies socially, emotionally, or health-wise?
Of course, if it's in children, you know, parents can dial it back by, you know, taking technology away, limitations. When we do it in adults, it becomes a different story because the adults have to be ready to change. And with some people with technology addiction, adults, just like any addictive behavior, are not ready to change until they hit so far bottom that they've lost their job, they've lost their family, that they don't seek to actually change the behavior until that point.
Okay. What has been presented in the literature regarding the impact upon technology and the performance of healthcare clinical practitioners and/or administrators? Of concern would be the need for strong interpersonal skills in interacting with patients, colleagues, etc.
There's some research out there, particularly when electronic medical records came out, that electronic medical records can, some studies have found, have a negative effect on the provider actually interacting with their patient. I've experienced this personally when I go to see my physician now versus talking to me, he talks to the computer. And that doesn't really shut me off, but that's because I was a healthcare person. But for people who are not healthcare providers or people who have a hard time telling their practitioners what their health problems are anyway, this can have a negative effect.
Okay. If there's a risk of technology addiction, what implications does that have for online education, particularly in secondary or even earlier years?
I think that it's something that we have to be careful of. If you have a child that perhaps is online all day long because they're taking online classes, then perhaps technology needs to be limited at night unless it's for schoolwork, because you don't want them to be interacting with technology that much. If you have a child, for instance, that's being homeschooled or taking an online classes at home, then they have to be involved in other activities. They have to go out and belong to social groups. Or, I homeschooled my son for a while, and, he was in Taekwondo and he was in a horse riding group. You have to take them out there where they actually interact with the environment and interact with the real world. I think that online learning is wonderful. I'm a proponent of it. I love it. I have loved it, and I've been in teaching it since almost the very beginning. But I think what we have to realize is that online learning is not for everybody, and it particularly might not be appropriate for people who have addictions. It could fuel the addiction in some cases.
Does anyone else have questions for Colleen? Is the addiction related to video games specifically, or just any screen time?
It's actually related to both. You'll see a lot more research out there right now on video games because they've been around for, decades, versus a lot of the smartphone applications which have not been out as long. So a lot of the research that you see out there initially it was television viewing and gaming, but you're starting to see more research now on other applications like cell phones.
Anyone else? Well, it looks like, one more, just when I think we're at the end. What should colleges or universities do regarding admitting those who may have a propensity for technology addiction? Would you recommend the use of the technology addiction test that you addressed in an earlier slide?
It depends because it's costly. And then, all of us are dealing with all the very rampant changes in higher education. Higher education is changing more rapidly now than it has in the past 200 years. We're all dealing with trying to get students to enroll, because if we don't have students to enroll, we don't exist. So, testing them is costly, but that could be an avenue. But perhaps maybe if you test them and find out that somebody has that propensity, provide some sort of education, I guess, would be the best answer. I don't think you'd want to exclude somebody based on that, because we can't really afford to exclude people who meet our criteria today based on any other factors, because everybody is struggling for enrollment pretty much.
Okay. And one person asked if it would be possible to get a copy of your references page.
Sure. Mm-hmm. If they just email me, this chalupa, that's easy. Just like the food. And I want to apologize to everybody. My allergies are bothering me really bad today, and I'm sorry I was coffee and my voice is off. But
okay. Somebody else wants to know if you have some practical solutions for adults who are borderline IAD. That might be me, by the way. Not my question, but it might be me personally.
Some techniques is if you are online and set a timer. Even, especially as we get to be adults, it becomes even more important because, I'm 52 and it's to the age, like if you have a job that you sit all day, we become, prevalent to blood clots in our legs and everything else. So setting a timer might be very helpful.
Okay. Anybody else? Last call going once. Twice. Well, I'm not seeing anything else in the Q&A window. So, the person says, I like the timer idea. I do too, because I do know that it's really easy to have an hour pass and you don't even realize it. So
It sure is. And I wanted to thank you all for coming.
and I want to thank you for presenting today, Colleen. This was really interesting and obviously applicable to all of us here at CGHS. So if you have any more questions for Colleen, feel free to email her at chalupa@atsu.edu. It's pretty easy to get to. And again, thank you all for attending today.